Welcome to this edition of the eClinicalWorks podcast. I'm Adam Solati. Today, we're talking about one of the biggest funding and transformation opportunities impacting rural healthcare and health centers across the country, the Rural Health Transformation Program, or RHTP. Joining me today is Jimeet Mehta from eClinicalWorks. Jimeet has spent the last year working with health centers, reviewing state plans and RFAs, and helping organizations understand exactly how technology and transformation come together under programs like RHTP. Jimeet, thank you so much for joining us.
Thank you, Adam.
So, Jimeet, give me the number one reason that tells people why they should care about rural health transformation right now.
Sure, Adam. So we have tracked over 250 state RFAs since January across 35 different states. Roughly, I would say 1 in 6 has real eClinicalWorks alignment. Now, that's not a niche. It's a wave. And if we talk about Indiana State, they have a program called as Indiana Grow Initiative. That alone is $206.9 million in the first year. On the other hand, if I look at Maryland, for example, they have about $73 million that they have put on the table in just a single RFA. Now, this is real money moving fast, and most of the health centers or rural groups are still treating it like a grant writing exercise.
And that's exactly what we're here to talk about here, isn't it, today, Jimeet? So let's think about big picture, okay? If I'm a rural health clinic or health center leader, why should this be the top of my priority list right now? There are so many things that face them. Why is our HTP the most important thing?
Because RHTP is not funding technology, it's funding transformation. States are not asking you what you want to buy. They are asking you how is healthcare going to look different in next 3 years. Right now, if you look at rural clinics or health centers, they are facing like massive triple threat, workforce shortages, high patient demand, and have intense pressure to prove better health outcomes. So RHTP is a big deal because it is the first time states are putting real financial power behind fixing all three massive headaches at the same time.
So, Jimeet, you've reviewed plans across dozens and dozens of states. What are they actually prioritizing underneath all the policy language? How should practices plan to participate?
So if you look at the surface, right, it looks total chaos because each state has its own priority. There are multiple grants that they are releasing every single month, in some cases every single week. But every state uses different name. For example, Indiana would call it GROW. Maryland would structure it around PHPA. South Carolina would split it into completely separate grant application. But if you look underneath these confusing names, there are three universal themes that would show up almost everywhere, which is workforce sustainability, patient access and engagement, and care coordination with measurable outcome.
Jimeet, what's the biggest misconception that you're seeing organizations have as they prepare to participate in this program?
So misconception and mistake, I would say, are two sides of the same coin. The misconception is that RHTP is just a technology checklist. So, I'll pick an AI tool, fill out a form, and boom, I'm done. You are not actually filling a boring shopping list. Instead, you are building a master plan that will change lives.
Yeah, I could see why that is a little bit different than what a lot of previous grants have been structured around.
If we stop looking at software catalogs and start looking at our own flaws, you know, we can kind of build a roadmap around three areas, which is, again, as I said, like workforce access coordination. But you have to be brutally honest about where your organization is exactly failing today. Are you asking three questions to yourself that Are my doctors and nurses literally drowning in paperwork? Are my patients falling through the cracks between the visits? Where is my staff wasting time doing manual things, which a computer system should be able to do for them? So once you find those answers, this is my friction list, my pain, and my headache. Um, you will find the answer, and that is not a list of your failures. That friction list is your transformation story, and that is what gets funded.
So, Jimeet, obviously, we're talking a little bit about policy here. We're talking a little bit about technology, but where does the technology actually fit in to the plans for these organizations? If this is not a technology checklist, as you had said earlier, how does it come into play?
So, Adam, technology is just the enabler. It is never the headline. Trust me, state reviewers can spot the difference from a mile between a team saying, "Hey, look, we bought an AI tool," and a team saying, "We completely changed how we treat people, and here is the tool that made it possible." So you can always start with real world outcome first, cutting down on missed follow up appointment, erasing out on after hours charting for doctors, finding high risk patient before they end up in the emergency room. So fix the problem first, then work backwards towards the technology that can solve them.
Okay, so we're talking about fixing the problems, not leading with a product or tool name, right? What does this look like day to day for a real health center?
Yeah, so it looks like a completely different day for everyone in the building. Let's look at, those three pillars. So if I talk from the workforce side, it means using ambient AI tool and automated workflows to cut down on your charting time. It means your doctors and nurses are actually going home for dinner instead of sitting at the desk finishing note at 9 p.m. If we talk about patient access, it means patient can easily book appointment. They can text their care team. They can get automated reminders through digital front door. No more playing phone tags with a frustrated receptionist, or I would say overworked receptionist, just to get a simple answer. And third is care coordination, which means when a patient goes to an emergency room or is seen by a specialist, your clinical team automatically sees that information right away. They don't have to find out about a medical crisis by accident at a routine checkup 3 weeks later. That is what I would say transformation would look like on a random Tuesday.
Doing how are organizations actually using eClinicalWorks against these three pillars?
We don't look at this as three separate toolkit. We look at it as a completely connected ecosystem when it comes to eClinicalWorks. So if you look at the workforce pillar, the goal there is simple. Give your clinical staff their time back and extend their capacity. If we think about patient access, we look at digital engagement, smart communication, AI-powered contact center tools. Now, that is how you completely wipe out scheduling friction. I'm sorry, scheduling friction. And for care coordination, it is all about interoperability. It's all about population health, value-based care tools. So we want to surface hidden gaps in care before they turn into a massive medical problem. And what we are doing is we are weaving all that into one single platform.
So in other words, the winning pitch here isn't just picking one tool to solve one part of the problem. Like you said before, it's really about creating an ecosystem, a process that that really reinvents, that transforms the way that practices have been offering services.
That's right. So think of it this way, Adam. The value is that workforce efficiency would feed access. Access feeds engagement. Engagement would feed care coordination. And it's all a loop, not three separate line items.
So, Jimmy, we're going to put these tools into place, hopefully these processes into place with the support of this funding. Fast forward 12 to 18 months, we're going to have to show some outcomes or some results, I'm sure. What does success actually look like for the organizations that get this right?
So, Adam, success has nothing to do with how big the check is. It is entirely about whether care was actually delivered differently. Success looks like clinicians spending their time with patient instead of them buried in documentation. It is a patient who can easily book an appointment on their phone without having to call your front desk 3 separate times. It is a care team catching a medical gap and saving a patient from terrifying trips to the emergency room. So the health centers that are going to win the next round of funding are not the ones with a signed contract. They are one who can pinpoint to real breathing example of that transformation.
Well, Jimeet, I think that's a great place to leave it. I'm sure you've inspired a lot of groups to get their thoughts together. This was a master class, Jimeet. Thank you so much, and thank you for making the case for RHTP so clearly, and for the reminder that the window doesn't stay open forever. I mean, it is a multi-year grant. There'll be stages, different opportunities, but it's not indefinite, right? So, to everyone listening, if you want to know how health centers are approaching workforce transformation, patient engagement, and care coordination under RHTP, don't wait. Reach out to your eClinicalWorks representative and visit our website today. The organizations moving now are the ones who are going to be telling the success story next year. Jimeet, thank you again. For the eClinicalWorks podcast, I'm Adam Salati, and thanks for watching.